evening, ladies and gentlemen. Welcome to Triple N Media COVID-19 World News. I am Dr. Nik Nikam from Houston, Texas. This is April 12, 2020. First, we are going to give you an overview of where the COVID-19 pandemic stands as of April 12, 2020, then highlight as how COVID-19 has fooled most world leaders and medical experts. The question is, are we going to repeat the same mistake when we are on the downslope of this pandemic? So let us begin. As of April 12, 2020, there are 1.8 million people across the world who have been infected with the coronavirus infection, leading to almost 110,000 deaths. And if you look at the distribution of these pandemic cases, United States tops at more than 500,000 cases of active coronavirus infection, with the numbers rising as much as 30,000 per day, leading to 20,500 deaths, which tops the number of deaths in the world. This is followed by Spain, Italy, France, Germany, China, UK, and the rest goes on. Now let's look at the statistics here in the United States. There are more than 500,000 cases of coronavirus infection, leading to more than 20,580 deaths. Here is the breakdown. New York City has been the epicenter of this coronavirus epidemic here in the United States, now leading the country with almost more than 180,000 cases and 8,600 plus deaths. Now we are seeing new epicenters popping up in New Jersey, Michigan, Massachusetts, California, Pennsylvania, Louisiana, and they are all rapidly increasing the number of new cases discovered each day. If you look at the daily new cases in the United States, there is some degree of hope as we see in the last 8 to 10 days. There has been a plateau that reflects maybe we are over the upslope of this bell curve as far as the new cases in the United States are concerned. Similarly, we see a similar trend in the daily death count in the United States, but still we can't say this has reached the top. But nonetheless, we have to keep in mind that death almost lags 8 to 10 days. Deaths lag 8 to 10 days behind the number of new cases because it takes so long for people to get sick and to be admitted. Next, let's look at New York City, which has been the epicenter of the COVID-19 epidemic here in the United States. And we can see a graph which looks quite obvious that it reached a peak somewhere around March 30th. But I want you to pay attention to some important numbers here. The New York City epidemic started somewhere along March 7th or 8th, and today here we look like we are on the downslope of the bell curve. But I want you to pay attention to this particular number where the New York City started lockdown on somewhere along March 23rd. And I will come back to this in a minute and explain where we went wrong. Here are the death counts, which is also showing a steady decline for the past 3 to 4 days. As New York is on the downslope of the bell curve, some of the other states like New Jersey, Massachusetts, Pennsylvania, Illinois, and even including California and Texas are showing an upslope with increase in the number of new cases discovered every day within the United States. Now, I want to get back to the main feature story of this presentation, which is how did COVID-19 fool most world leaders and medical experts? Or are we going to do the same mistake on the downslope of this bell curve of the COVID-19 pandemic? As we can see, there were traces of unexplained pneumonia somewhere along December 31st, 2019, which is the one that gives the name COVID-19 because that's the reference to year 2019. The first glimpses of COVID-19 infection in China and particularly in Hubei province began somewhere along the middle of January. They started the lockdown somewhere along January 23 and 25th. I wanted you to pay particular attention to these dates here because between January 31st and January 25th, there was an incubation period during which time there were several people who were infected and were transmitting the virus to several other people. As we can see on January 23rd, when they began the lockdown, they almost had 1,000 cases, active cases in the hospital, which means there were a lot more cases in the community spreading the virus like a wildfire you see in California. As we learned from the natural history of the COVID-19, that 80% of the people who have this virus are asymptomatic, and these are the people who are spreading the virus in the rest of the community. And as we can see, on January 23rd, it had reached almost 1,000 cases, new cases per day, and it was only on February 1st when the United States banned all flights coming in and out of China to the United States. And even then, several airlines were still flying flights, and I'll come back and explain as how they were responsible for spreading the infection here in the United States. Now the question is, what did we learn from this graph? And what can we do in the future? I'm talking about immediate future as we are trying to jumpstart the economy. Between December 31st and January 23rd, there were active cases of coronavirus spreading all across China and in particular Hubei province. And when people who had gone for the Chinese holidays were returning from China to Europe and United States, they were potential carriers of the virus, which resulted in a spread of virus in Europe and also in the United States. By the time we recognize there are 100 or 500 or 1,000 patients, it is too late. The actual time to have started the quarantine would have been at the early stages of the recognition of this epidemic. They started the quarantine on January 23rd, and it was approximately 2 weeks before they could begin to see a dramatic fall in the number of new cases in China and in particular Hubei province. So this clearly shows that lockdown has a significant impact on the spread of COVID-19. If the other countries like the United States and Europe had banned the flights earlier, at the earliest sign of epidemic in China, and quarantined all those people who came to the United States from China, isolated them, it could have been a different story in Italy, France, and New York City. When and how, so let us keep that in mind when we say the number of new cases are dropping, the death counts are dropping, and maybe it is time to think about jumpstarting the economy. Not so soon, ladies and gentlemen. When and how do we jumpstart the economy? Are we going to repeat the same mistake we did while trying to recognize the lethal effect of the COVID-19 epidemic. When we are thinking about jumpstarting the economy, let us look at the graph from New York City. As you can see here, the New York City began lockdown on March 23rd. They did the same mistake which was done in China and Hubei province. If New York City had started the lockdown somewhere along here when they had recognized a sizable number of counts, then this graph would have been much flatter and would have been much milder than what we are seeing here. The next question is, when you talk about jumpstarting the economy, when do you think it is a safe time to jumpstart the economy? Because we still have patients who are having active cases of coronavirus. And as we know that people who are symptomatic or asymptomatic can spread the virus or spread the infection up to 14 days or up to 3 weeks, 21 days. Supposing we jumpstart the economy at the end of April or 1st of May, what about all these people who have been infected, who may be spreading the infection? Once they get into workplace, again it will be like a California wildfire where it will spread to the entire population at the workplace. So how do we address this issue? When we are talking about jumpstarting the economy, there are several aspects that we need to focus. We need to take into account, what about all those who had tests 4 weeks ago, who tested negative? Shouldn't they be able to return to work in critical areas? How do we know they are not infected? Should they be retested? Should we test everyone returning to work, especially healthcare workers? Because we don't want people to get sick or spread the virus. There are already answers to these questions indirectly, because there are hundreds of thousands of people working in retail areas like Walmart, grocery stores, and in warehouses for online businesses which are booming. So there is a lesson for us that yes, indeed, we can jumpstart the economy, but certain things need to be taken into consideration. First, we need to maintain the distance between people as we are doing long after we return to work for at least a few weeks. Number two, we should also be taking into consideration that these people who are returning to work are not active carriers of the virus. That may be a bigger question which needs to be answered in the coming days and weeks before we talk about jumpstarting the economy. Even if we jumpstart the economy and people return to work, I personally feel it is important for us to follow the same steps that we have followed in this lockdown period so that we have less chance of spreading the virus to others or getting the virus from others. Look at this graph here. If one person who is a silent carrier of the virus and is in close contact with another person who is not wearing a mask, there's a high chance of the transmission of this virus. On the other hand, if both people wear the mask, the chances of spreading the virus are much lower. Along with that, if we maintain distance at work as we have done for the last 2 to 3 weeks, there is a good chance that we should be able to contain this epidemic as we jumpstart the economy when it is time to start the economy. Ladies and gentlemen, thank you so much for watching this presentation. Stay tuned for more educational videos on COVID-19 pandemic. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel, and we will see you next time.